The current crisis, of course, is the COVID-19 pandemic. And what this airborne virus has done is that it has taken us off guard. And there are some safety measures we can take. Quarantine if we're sick, refrain from non-essential activities. And these are scary times for many of us. And with these sorts of suggestions, the questions for us become, well, is ABA an essential service then? And there's been some great discussions about this. There is no universal decision to continue or to stop services. The other question is, okay, if we determine that the service is needed and it's essential, how can we deliver this care from a distance? That's not what we're used to doing. And how can we do it effectively? Well, some of these things apply when you're physically available. Setting clear expectations of what things are going to look like when you are watching a supervising and providing feedback with this medium will be very helpful. And reviewing any existing guidelines that you're finding and protocols with supervisees, I find it's really helpful to not just send a reference or send a link and share with my supervisees that, oh, this is out there, but rather to take the time to use a medium such as Zoom, which you're all using, to review it together and then leave time for them to ask me any questions they may have. And then ask, how do you see how you could apply this information or these guidelines to our clients so that they feel prepared to use it. Also, this is a really good time to consider other technology you may want to adopt to facilitate the process so that any way that you can decrease the level of effort and time and energy someone has to spend, you would want to try to do that for them. Examples of this are to use phone scanners, for example, to scan billing and paperwork, and to teach supervisees how to do that, or to at least troubleshoot and go through it with them. I'm not saying that we become complete experts in all of those. Also, we use behavior skills training, as well as observe and record the performance of the supervisee using the very checklists we use to give them those expectations. Now, we have to be able to provide feedback through all of these sessions, and feedback is the method by which we can actually change any behavior. So I'm going to spend some time talking about how to give feedback using remote services. And last, but probably the most important aspect of being a good supervisor is learning to build strong relationships with your supervisees. So how do we train new skills? This is really one of my favorite things about supervising is training and teaching new skills, because your supervisees then gain an entire repertoire, and that's an investment. As they gain skills, the less effort you have to put because now they have it in their repertoire. And really, we use behavior skills training. That's the gold standard, and we can continue to do that remotely. We can review or instruct on the procedures. We can do that via Zoom, via computer. We can provide that as instructions. We can also model across of a computer by having video feedback or show videos. The next phase is to rehearse and make sure that the individual can actually implement what they watched. And you can do this with either you as the simulated client. It feels a little odd when you're sitting across of a computer and you're engaging the computer, but it actually works. I'm going to show you some good research that shows it does. Or you can ask that they find someone in that environment if they are staying at home with someone else. They have a partner, spouse, family member who can actually do that. And so that individual then becomes a simulated client, and you can observe that way and then provide them with some feedback using a performance tool. The other thing is that you want to continue to teach, encourage, and reinforce good communication. As I mentioned before, this is the one that's likely to be impacted because when we experience fight or flight, one of the things that may get interrupted is our communication ties, and then we may not take the time to communicate with all the parties about what we're doing and how we're feeling. And that may be true with the family and clients, and that's extremely important because just like the rest of us, they're under a lot of duress. Parents are dealing with kids that are home, running around all the time, and they have to figure out how to fill in those hours. They might be working from home, so they're also dealing with that balance. How your supervisee speaks with their colleagues and other professionals. This is a really good time to identify, do they create panic? Do they talk about or gossip about things that results in a negative atmosphere? These are tough conversations to have, but still extremely important conversations to have with our supervisees to set them for success in the future. And of course, how they then communicate with you as the supervisor to be able to seek your help, seek your advice, to secure it is also really important. And we could be speaking with our supervisees about how to do that better.